For sharing with us, and I understand that you have information you want to share with us, kind of an update as far as this goes. So we'll turn it over to you, but if it's okay, we'll jump in from time to time.
Yeah, please. I just got some notes here that I gather from time to time, just to. Yep.
Why don't we go around and introduce ourselves, just so we.
I'm sorry.
Joe Buckowitz, Executive Editor.
Again, Mark Jones, Editorial Page Editor.
Tim Schilling, Vice President Mark.
Cortina.
Peter Senior Staff Writer.
Gerard Hetman, Online and Digital Media.
Nice to meet you.
Clark Van Orden, Photographer.
All right, thanks.
And we'd like, in these meetings, we stay on the record.
Okay.
If there's something of another nature you'd like to talk about, you can talk to Andrew afterwards.
Okay, sure. Well, we appreciate the opportunity to come and visit with you a little bit today. We've been, CHS bought the hospital back in May of '09, so it's been just a little over 2 years, and we have had quite a few accomplishments that we're very proud of. We've got a terrific team there, and just thought it might be an opportune time to come and share some of that with you, kind of update you on what's going on and respond to any questions which you might have. And again, anytime jump in and we can talk about anything that's on your mind. But one of the most significant things that we're in the process of accomplishing right now is, of course, our new addition to the hospital, a cardiac care center and emergency department. It's about a $53 million project, and we're well into that. We're scheduled to open that in the fall of 2012, so about a year from now that'll be open. It's going to double the size of our ER, and it will, from its current state, and we're going to add 3 new cardiac catheterization labs, a new electrophysiology lab, and a new space for nuclear cardiology. That's on the ground and first floor. Second floor and above will be new space for private patient rooms, which are really needed in this market for patients looking to go to the hospital. Everyone would like to have a private room, and that's something that we look into opening up. Back in January, we announced an affiliation with Intermountain Medical Group, which is a 52-person doctor group. In addition to coming together in a significant way with Intermountain, we also acquired their 4 ancillary businesses. They had a sleep lab, a clinical lab, a physical rehab center, a physical therapy center, and a imaging center called Center for Diagnostic Imaging. So we acquired those 4 businesses, and that's now become part of the Wyoming Valley system. We also recruited into that group recently Dr. Mike Tedesco, who's a gynecologist who had a very busy practice over here in Wilkes-Barre. A number of years ago, went to Scranton, where he still maintains an office, but now he's come back and will be sharing some time with us over here. Dr. Tedesco was one of a number of physicians on our staff who practice robotic surgery. This is an acquisition we made about 1.5 years ago. We bought a robot, a Da Vinci robot, and now we've got probably half a dozen doctors. Seven
robotic
and a variety of specialties, GYN, urology, and general surgery. They're working on the robot, and we've seen a nice increase in the volume of that, the number of patients that are treated with robotic surgery with very, very good results. One of the surgeons that we recruited here from out of the area, a physician named Dr. Jose Mises, is a gynecologic oncologist. And that's a specialty which has been absent from this area for some time. Dr. Mises comes up 1 day a week, sees patients out of one of the existing OB/GYN doctor offices, and then does surgery on the following week. And he's been quite busy and really brought, again, a specialty to this market that we haven't had to date. In December of 2010, about 6 to 8 months ago, we launched our chest pain center. Just a week ago, we had our inspection for that, and we got the preliminary word that it will be a certified center. We haven't yet got the final approval back, but we had a very good review of the chest pain center, and that's going to allow us to provide even more consistent and outstanding care to residents coming to the ER for chest pain. In addition to that, we've been named the Blue Distinction Center of Excellence by Blue Cross for chest pain, for cardiac care. Physician recruitment, we've been very active in recruiting physicians to the market. In the last couple of years, we've recruited 20 doctors to the area in a variety of specialties, including pediatrics, OB/GYN, general surgery, bariatric surgery, neurology, cardiology, and neurosurgery. With respect to bariatric surgery, that's another new service for us, a fairly new service. So we launched in about the last year or so. Dr. Clark Gerhardt, who's been on our staff for some time, is doing the bariatric surgery, as well as Dr. Gary Neal, who we brought in several months ago, was a board-certified, fellowship-trained bariatric surgeon. And you know, the market here has been without a bariatric surgeon for some time, and we have found that patients who undergo this kind of surgery have a tremendous improvement in their quality of life. A lot of these patients have diabetes and other healthcare problems, congestive heart failure. When they have the surgery, they drop their weight. They find a lot of these other comorbid conditions they have are significantly improved.
Can I back up just for
Sure.
a second?
Sure.
And maybe it's obvious, but if you could spell out a little bit, the robotic surgery, what are the advantages to the patient in that significantly limits your recovery time in those cases?
The recovery time is
Weeks
much.
to days,
yeah,
possibly?
yeah. The operative time might be in some cases a little bit longer, but the recovery time is much quicker. There's much less pain associated with the surgery because the incisions are so small, and the results oftentimes have been better than with traditional open surgery. So quicker recovery time, less pain, and less invasive.
Previously, I'd go to Lehigh Valley, Philadelphia, or where would I?
Lehigh Valley has a robotic program, and then Philadelphia, New York. Yeah.
Okay, thank you.
Yep. Sure.
You know, we might want to add too about in the orthopedic area, in particular, we're doing a computerized knee and hip replacement procedure that really is not being done anywhere outside of the region here. Dr. Raklevich, the chief of orthopedics, is doing this computerized, it's called Pi Galileo, computerized knee and hip surgery, and it also brings the same kind of benefits to the patient. So he's a very long time and active orthopedic surgeon, but has trained extensively around that, and it's kind of like a robot. He actually did a procedure with a company called Brain Lab a few weeks ago that was the first of its kind, you know, in the state of Pennsylvania, using that software and technology to do the knee. And it really provides for better positioning of the instruments and so forth to do the hip. In this case, I think the first one's a hip, but he does knees more frequently. So in addition to the robotics in orthopedics, I think we're doing some really cutting edge kinds of things using computers, and I really stepped it up in that particular specialty.
And the recruitment, is that a tough sell these days? We heard a few years ago about the shortage.
Yeah. You know, we have a number of physicians who are getting busier than they want to be. We have some other doctors who are kind of getting up there in age, looking to slow down and retire. And so we're constantly recruiting for a variety of reasons. Is it a tough sell? You know, this is a beautiful area, but for some reason it's more challenging to recruit to Northeast Pennsylvania than it is to Palm Springs. I don't know why. So I don't know.
Something about flooding, maybe.
Yeah, who knows? But actually, we've had pretty good success. You know, knock on wood, we've had shortages in certain areas we've been able to recruit into. We're continuing it though. We still have some areas where we have coverage by the specialty, but the guys, the physicians are very, very busy, and they could use some relief. So,
I guess along the same lines, a relationship with Commonwealth Medical College at this point, or is that more of a long-range type of thing?
The Commonwealth Medical College is a very important partner of ours currently, and I think they're going to become more important as we go forward. There are, as you know, I think they're in their third year of students now. They just started their third year. We have a group of 20 students that come over every year and rotate through our facility in a variety of different specialties. We do look to sort of strengthen the relationship with the medical college. One of the things we've talked with them about is the development of some additional residency programs. As you may know, we have a residency now at William Valley in primary care, in family medicine, and the medical college has talked to us preliminarily about developing residencies in hematology, oncology, and psychiatry. We have a very strong and active psych business program at the hospital, the first hospital up at Nesbitt, and there's a need for psychiatrists. So they've talked to us about the potential developing residencies in those two areas.
Glenn Steele was here
week, 10 days ago, I've lost track.
Yeah.
And along the same lines, trying to keep us up to date what's going on. And he spoke highly of two robust systems, two systems that operate differently,
Yeah.
and how it's good for the market. Can you give us your perspective on that?
Yeah, I would echo Dr. Steele's comments. I think whenever you have two strong competitors, they tend to make each other better, and the ultimate beneficiary of that is the community that we serve. I have a lot of respect for Dr. Steele and for the guys in our system. They do good work, and I feel there's some mutual feeling, mutual admiration on the other side as well. And I think that when you do have two good, strong systems, the group that benefits are our customers, our patients, our doctors, and ultimately the community.
Yeah, certainly you talk about systems and about doctors and improvements to your facility. That is good for the people that are here.
Yeah.
That's,
It is, and we think we're being a good corporate citizen by, we're a tax-paying entity, and I know that our city and our county are pleased with our ability to help to provide some money for the coffers there. We work with the colleges, the local colleges. A number of students come and rotate through our facility, not just the medical college, but Wilkes, Misericordia, King's, and they'll Tri-C come over with nursing students, imaging students, pharmacy students.
Cooperative pharmacy with Wilkes, cooperative radiology with Misericordia.
So there's a lot going on.
Is it the nursing from Misericordia, the pharmacy from Wilkes? Is it more than that, or
it's nursing from
LCC,
from Wilkes, and from Missouri.
Yes.
King's are the PA students, physician assistant students from King's. In pharmacy, we said from
with Wilkes, and radiology, as you said, Joe, was with nuclear medicine, which is a part of radiology, is with Misericordia.
And then we have an affiliation with the University of Scranton for the School of Anesthesia. We have CRNAs, certified registered nurse anesthetists, that do their practical work at the hospital through Scranton. I guess that's it.
That covers it.
Yeah. Talking more just a little bit about some new programs, services, development. We recently opened our new joint center, for replacement center, at the hospital, and this is that and a new center for advanced rehab. And these are two services which we've always provided orthopedics and joint replacement work, but now we have a more coordinated approach to care of patients that have joint replacement surgery in both hips and knees. And the Center for Advanced Rehab is now caring for patients that used to have to be referred out for physical medicine rehab post-surgery. They would go to Hines or other facilities for that. So now we've got a 20-bed unit. It was opened up June 1 and has been full for about a month and a half. So we've got running full census there, so clearly there's a need for that. We also opened up, or broke ground rather, back in May for a mountaintop medical office building. I think you may have been on it. I know we had some folks out there.
On all these matters. Thank you.
And so broke ground on that, and that should open up probably by January of 2012. And that'll be a medical office building and ancillary facilities out in Mountaintop. Up at Saxon Pavilion, which is our outpatient facility, very busy. Outpatient center there for imaging, for lab, for cardiopulmonary services, and for rehab. We are going to be starting probably in January sort of a renovation of that space to enlarge the scheduling area. Because right now it's a little bit tight, and with the growth and volume that we've seen there, we found it necessary to expand our scheduling and have actually a central scheduling area for all the patients coming for outpatient work.
Well, you might want to add, we did add already to the Women's Imaging Center.
Right.
Renovations there. We have a very busy Women's Imaging Center. It does thousands of digital mammograms for women in skin. And in the last several months have renovated that facility to make it more patient-friendly and ease of access for our patients there. So that was the first phase in the centralized registration, which is big because of the very high volume. The Saxon Pavilion is far and away the largest outpatient facility we have, and certainly the largest in the region.
Can I jump in here?
Yep.
You keep hearing about these additions, improvements, new services. CHS obviously has new facilities now up in Scranton, Tunkhannock, Nanticoke. What is the relationship between the former Mercy's and your facilities down here Are you installing things that will attract patients from up there? Are you looking, or CHS looking for them up there to add stuff for your patients to go to? Or are you totally separate and you'll have your services, we'll duplicate them up there, and there's a borderline?
No, it's a good question, Andrew. I mean, Wilkes-Barre and Scranton, as you guys know, are really two different markets in healthcare, in shopping, in a whole variety of areas. The two hospitals up there, Scranton and Moses Taylor, Scranton Regional Moses Taylor, and CMC, will continue to serve that market primarily. I think there'll be more collaboration between Moses Taylor and Regional Hospital Scranton than perhaps there has in the past, because they were competitors, and now they'll be sort of sister facilities. But as far as patients from Scranton coming over here to Wilkes-Barre General, unless there's something specialized that we do that they don't, I don't see patients coming over here for general medical and surgical care.
Or are you trying to, with some of your specialties, bring patients down from there that Mercy and Moses do not cater to?
Yeah, right. I would say if there is a service like that, and we can provide that service just as we do today, we would be happy to treat those patients. But there's no plan at the moment to discontinue services there or consolidate services that are currently over there and bring them over to us.
On the flip side, have there been any programs, services that just didn't fit with the new model? Is there a nurse-family partnership?
There's a program, a nurse-family partnership, that is still in existence, but it's managed by another entity. And
Maternal and family health is.
Okay. Yeah. So we made a commitment when CHS bought the facility to maintain the programs and services, I think, for a minimum of 5 years. We've been in there too now. Really the services and programs that we offer, we feel committed to continue to maintain. And Psych's a good example of that. I mean, we are the only hospital in the company, I believe, that has such an extensive offering in psychiatric services, drug and alcohol rehab, inpatient adolescent, or inpatient and adolescent and adult. And we provide that service in a very significant way. We do it very well, and as a matter of fact, I think we're a model for the rest of the company. That if we have other hospitals and they look to get into the psychiatric business, I think they would look to Wilkes-Barre as sort of the way to do it.
Since CHS has come in, we know there were financial issues with the predecessor. How did I don't know how many details you can get into, but have you turned a profit? Have you turned it around? How significantly?
Yeah, we've turned it around. I think that we are we are in the black. We've made a lot of improvements in processes, in the way that sort of the back office sorts of things. We are part of a large system, so we are able to purchase supplies and equipment at a discount, at a rate that's much more favorable than a single standalone hospital can do. So yes, we've had a turnaround in the financial operation of the hospital, and really, as a nun who oversaw a large Catholic hospital system said many years ago, no money, no mission. And if you don't have a positive bottom line, you can't provide the services that the community expects and deserves and needs.
Were you impacted by the flood? And I'm assuming quite a few of the facilities, I'm sure, were evacuated.
Yeah, we did. All those over in Kingston, First Hospital, our Saxton Pavilion, a number of our doctors' offices were evacuated. And by the way, I'm glad you brought that up. We transferred those patients to Clark Summit State Hospital. Took many of our adult patients. Our own hospital took our pediatric psych patients. Special Care Hospital in Anaco took some patients, and Berwick Hospital took some patients. And we had nothing but positive responses from them initially, saying, yes, we'd be happy to take them. And then the reaction of our staff said they couldn't have been treated better. The patients were wonderfully treated, our staff, the folks were very accommodating. So we are very appreciative of the response of the community in helping us out during this time period.
A letter to the editor to that effect.
We did, that's right, we sent one.
Good.
Yeah. The community was terrific and treated our patients and our staff wonderfully. But fortunately, the short answer to your question is no, we had no damage at the hospital or over in the places in Kingston. Everyone evacuated, but the water, fortunately, never got up that high, so we were okay.
You bring up the community. When you guys were coming in, there was some unease about losing our community hospital and so forth. Have you seen a change in acceptance for the community in the 2 years?
And I'll tell you, and I've said this right from the beginning, I got here in May of '09, or April of '09, and the response from the community, to me personally, has always been overwhelmingly positive. Be it, Rusty Flack was the board chair when we bought the hospital, and, God rest his soul, he introduced me to many, many people, and I found that throughout, the 2 years I've spent here, is that the acceptance from the business and non-business community has just been tremendous. Very warm welcome for me and our management team, for CHS as a company, the mayor, all of our government officials. The business community has been very welcoming, and yeah, we're part of the community. And again, we don't talk about CHS. It's Wilkes-Barre General Hospital, it's the William Valley Healthcare System. It's the local community that we're serving. This is our market, and these are our people. And yeah, but it's been very positive right from the get-go.
There was discussion at the time of the sale that there'd be created I believe, multi-million-dollar health foundation. Can you tell us the status of that?
Yeah, there is a health foundation called the Appleseed.
Yeah, I'm not certain.
Okay, I think we can confirm the name.
Yeah.
I think it's called the Appleseed Foundation.
Yeah, you can. It's tomorrow.
And actually, Rusty was the chair of that. Rusty Fleck was the chair. With Rusty's passing, Ken Kragolski's taken over. Ken's taken over as the chair of the Appleseed. I think it's called the Appleseed Foundation. And I don't know the assets of it. I don't know how much is in there, and I don't know if they've distributed funds yet. But again, their goal is to provide funds for health initiatives within the county. But I really am not up to speed on what they've done thus far.
Okay. I guess just personally and professionally, if I could get more information on that when it becomes available,
Sure.
to let people know when it is, when it's time for them to be able to apply for this, for any grants.
You want to call Ken?
Yeah.
Okay. All right.
Absolutely.
Yeah. All right. Yeah.
And that's an independent group then. Was there consideration about folding this into Luzerne Foundation or some other existing foundation?
I don't. Not that I know of. I think they were created as a result of the acquisition of the hospital by CHS, and I don't know if they have talked about becoming part of the Luzerne Foundation or not.
What is the employment situation currently with the system, and what was it when you guys took over?
For you mean numbers of employees? We've got about 2,900 employees, give or take.
28 plus 29 is around
2875.
Yeah.
And that's about what it was when we acquired the hospital. Now the difference would be, or the biggest differences would be Heritage House that we sold to the Diocese of Scranton. We had, I think, about 200. Well, maybe it wasn't that. Maybe it was 200 employees there. And of course, they are now no longer part of us. But it's about the same. We lost some employees there. We gained some employees when we brought on Intermountain Group.
Number of nurses?
Around 400, Andrew, I think was the number that.
That's about the same.
That's about the same. Yeah, that's about the same.
And how about physicians?
We've got about 400 physicians, and that's we've brought on a number I've mentioned earlier, and we've lost some, so that's about the same as it was.
Were there any what you talked about back office positions, buying in bulk purchasing and so forth? Were those positions lost? If you have, was that the biggest group of positions that were lost?
No, I don't. Looking at the back office, the business office, purchasing, medical records, we really didn't lose many employees there. I don't know how many we did. There may have been some retirements. I think we probably had some folks retired that we didn't fill those empty positions, those vacated positions. But as far as a layoff, we have not done a layoff, and have not, other than again not replacing positions that have left. We don't plan to do that.
If you had visited last week, I wouldn't ask this question, but as a result of recent events, what is the disaster plan if your main hospital isn't able to be used? Is there a plan in place for where patients would go in the region?
If the main hospital had to be abandoned, where would we move the patients? I suppose we would call around, to the other hospitals in the region and see who would have space to accommodate them. We have transfer agreements in place with hospitals in the area. So really, any hospital that would have available beds, and the state has a plan as well for if your hospital is hit with some circumstance that would require you to vacate your patients. We have arranged with the hospitals in the area where they could be sent.
And unfortunately, we're high and dry, as Joe knows. In fact, other hospitals came to us back in '72 because of Wilkes-Barre General Hospital's. You know,
I'm thinking of when you say that, I'm thinking like a Natico chemical fire.
Yeah,
you know,
some sort of
Earthquakes or exactly.
yeah,
So
earthquakes.
you never know
Who
when
knows anymore? Locusts.
Yeah, really.
I saw a headline in one of the Philly papers. What's next, locusts? You know? So
Geisinger, when those folks were here last week, talked about their brand and expanding their brand into growing areas of the Poconos, even out to New Jersey, making their presence in Scranton, gets them up into Susquehanna and Wyoming and surrounding counties. From your standpoint, is the Wyoming Valley Healthcare System and the Wilkes-Barre General Hospital primarily focused on Wyoming Valley, Luzerne County, or are you trying to get expanded offices and physicians out in Earl, Lackawanna, Wyoming?
Yeah, I think as you look at the market, certainly Wyoming Valley Healthcare System, Wilkes-Barre General Hospital is focused in Luzerne County. With the acquisition of Regional Hospital Scranton and with the discussions going on with Moses Taylor, as they join the CHS system, I think you'll see more of a regional presence clearly with CHS through these three hospitals and their affiliates. And so I do see the brand of our company, and it won't, most likely will not be branded as CHS, but we'll come up with some brand for that. You'll see us grow beyond Luzerne County, beyond Wilkes-Barre. As far as getting over into New Jersey or further west of here, we have, west of here we've got Berwick Hospital, Sunbury, and Lockhaven that are part of the system. But we haven't, at least to date, worked on developing a regional strategy for the hospitals to our west. I think that our hospital in Luzerne and the hospital over in Lackawanna County, you'll see some additional branding and working together between the three of us.
That the future of this region will be two major branded health systems?
We believe so, yeah. Yeah, I think so. I think you'll see going forward, you'll have Geyser, and then you'll have the CHS affiliated facilities that'll be the other brand in the area.
What's the importance of that, of getting that brand, making it a regional system?
I think that the patients will, or in the community, the physicians will have a choice, and they'll see, well, I've got Geyser on one end, and I've got the CHS facilities on the other. I think that there is a difference in philosophies. I think Dr. Steele had explained to you, or a difference in approach. I think at the end of the day, the answer to the patient is, as we talked about earlier, Joe, is that you're going to see an increase in quality and an increase in service to the patients. One of the things that we focus on right now very strongly is a program that we call Community Cares, and it's a program which has been rolled out in all 120 some odd hospitals that CHS owns. And it has three main goals: to create the kind of environment where patients want to be treated, where doctors want to work, and where doctors want to practice their craft and where employees want to work. And it comes right down to simple things like ensuring that our nurses make hourly rounds on our patients, or in the patient's room every hour to check on them, make sure they've got what they need and that they're comfortable and they're hydrated and so on. It focuses on making sure that our managers are getting rounding on our employees, make sure they have the tools and equipment to do their job. It focuses on making sure that our employees, when they go into a patient's room, they introduce themselves. They explain a test or treatment that they're there to administer to the patient, that they ask the patient if they have any questions before they leave the room, that we ensure privacy. Basic sort of blocking and tackling kinds of things, but that really at the end of the day make the patient experience a positive and rewarding one for them. So I think that the ultimate beneficiary, again, is going to be our customer, our patient, and our doctor in the community. And having that brand, that CHS brand, or whatever we end up calling the system here, people will go to that and they'll have a quality, high quality, patient-focused experience.
At that point in time, when you do have that brand and the regionalization out there, I know you said that you weren't use that line, that Luzerne, Lackawanna County line. Why will that be breached with the brand? Why do you think people will then see one region?
Because, I think that right now, and heretofore, there has been a sort of a dividing line, that invisible dividing line between Wilkes-Barre County. I think once you have a brand, it's going to, it'll help to break that down, at least as far as healthcare is concerned. Because I think someone who lives in Lackawanna County, it's just, I want the best heart surgery I can get. I want the best neurosurgery, the best robotic surgery. And I know if I can get it here at the CHS branded facility over in Lackawanna County, my assumption I can do the same thing with that same high level of quality over in Luzerne County. I think it will help to start break down that barrier, because when you buy Heinz ketchup, whether you buy it in New York or Florida or California, it's Heinz ketchup, and you're assuming a certain quality associated with that brand, whatever that is. And I think you'll see that in this market, in this region, with the community health systems.
Have you started, I'm assuming you've started those initiatives with customer service, with the nurses making the rounds and the people making?
Yes.
Have you had feedback from the customers about that? I'm sure you engage them very
closely. We do. We look at it all the time.
Yeah.
And we've had very positive results. We've seen a consistent improvement in our patient satisfaction results quarter to quarter, largely as a result of these initiatives that we've undertaken, making sure the nurses are rounding, making sure managers are rounding on their employees, ensuring that we are producing ourselves, just providing the kind of experience that patients expect. And the consumers are very discerning these days, and there's choices. They don't need to come to Wilkes-Barre General Hospital. They can go to some of the other hospitals in the market. And so we've got to ensure that we're providing the absolute best care we can. And again, this is coming out in our employee and our physician satisfaction surveys, that the quality is improving and their level of satisfaction is improving.
How early in the process were you made aware that CHS was eyeing up Mercy and then there was a seller?
How early in the process? Well, before it was public.
But did they approach you and ask you for your opinion of that region and the?
Well, living up here and being in the market for a couple of years, I was. Did they ask me my opinion about it? I think they said, we're looking at that market and it doesn't make sense. But I was supportive of it.
Have they approached you to let you know that they're looking at any other area hospitals for acquisitions, whether Hazelton, Program Medical?
No, not at this time.
Would it surprise you if they were to?
Well, CHS is always looking for good opportunities. I would say they're always looking for good opportunities. The company is strong and is growing, and I think that there are a lot of acquisition opportunities throughout the country. A lot of hospitals are struggling these days, and they're sort of capital starved. And CHS does bring a winning formula, does bring a process or a system where a struggling hospital can survive and thrive. And while I don't know of any specific instances, I'm confident that they're looking at a number of opportunities throughout the region and perhaps our country.
What's been the most frustrating aspect of your job since you started 2 years ago?
The most frustrating aspect? I probably being able to accomplish everything that I would like to within the short period of time. I think anybody that runs a business, you got all these ideas and all these things you want to do, and there's only so many resources, either time or money, and you can't do it all. I'd like to be able to recruit more doctors. I'd like to be able to start a few more programs, but you sort of got to prioritize things and sort of knock them off by the ones. And as you heard, I think we've had a fair number of successes over the last couple of years, and we look forward to achieving some more going forward. But it's probably just do as much as you want to do, as quickly as you want to, as quickly as I want to do it.
When CHS took over Wyoming Valley Healthcare System, the system was in the red. Were you guys in the black yet for the first year? Or did it take 2 years to do that?
I don't know. I guess I can answer that. Yeah, we were in the black after the first year. Yeah, within 12 months, we were.
How were you able to do that? You discussed that, but primarily to do that much of a turnaround that quickly, what was it? Was there one thing in particular that you were able to do that without layoffs?
Yeah, I think it was it was, again, a lot of the basics. It was collecting bills, the money that was owed to us, I think was one thing. We were able to put into practice some business office procedures that your newspaper has, I'm sure a lot of doctors' offices have, regarding if we're going to provide a service, we would expect to get paid something for it. So we started doing that. We, again, were able to save a substantial amount on our purchasing through this group purchasing agreements that we have. We renegotiated some insurance contracts, some managed care contracts. Those are some of the primary things.
Would your predecessor have been able to turn it around? I know that they often talked about how it was.
Yeah,
They needed you guys to come in, or somebody to come in. Would
Yeah.
they have been able to, from what you know, what you've seen?
I think it would have been a challenge. I think it would have been tough. You know, some of the, I think CHS just has a way of implementing some of these changes that are difficult in a nonprofit system. And so I think it would have been tough.
How's the National Health Care Act and now some of the backlash to it, is that affecting the way that you do business?
You know, it hasn't, well, to a certain extent, it's going to affect us more as we go forward. You know, this, what they call value-based purchasing, which is part of the Healthcare Reform Act, looks at patient satisfaction scores and what we call our core measures scores, which are indicators of quality, and for heart failure, for acute myocardial infarction, for pneumonia, and for surgical procedures. So what it does, if you take a dollar, I think it's 30 cents of that dollar, you will be reimbursed in part based on patient satisfaction scores, and 70%, and we need to confirm, it might be 2080. Is it 2080?
We can.
Okay, we'll confirm it. Will be based on your performance in these certain clinical measures. So we started some time ago, as we talked about a moment ago, our patient satisfaction scores. We focus on that. We focus on providing outstanding care, and we've seen our scores improve. So a piece of that reimbursement from the government is going to be based on that, and then the bulk of it on our quality scores. And we've seen an improvement in our quality measures, these objective quality measures that the government has set out, we call our core measures. And we look at those on a quarterly basis. And most hospitals around the country are seeing their scores improve because everyone is going to have a portion of their reimbursement from Medicare withheld based upon, or given back to them based upon how well they do in their patient satisfaction and quality scores. So yes, the short answer, it is affecting us. Now, there will be a greater percentage of that money withheld or given as we go forward in 2012, 2013, 2014. There's a whole variety of other things in the legislation that will sort of pushing us in a direction of collaborating more with our doctors. There's an entity or a thing called an accountable care organization, which essentially reimburses a hospital or a health system for keeping the population healthy. So what we would do is we would collaborate with our doctors and with an insurance plan to keep a certain population that we're responsible for out of the hospital. Right now, as you know, we get paid when patients come to the hospital. If we keep somebody healthy, they don't come to us, we don't make anything. So we're going to be incentivized through this new legislation to be responsible for the care of a certain population. If we keep them healthy, we'll be able to share in some of the savings that are generated. It's called the shared savings model. So, yeah, I mean, there's a lot to it, but the short answer is we are impacted to some extent today. Going forward, we'll be impacted all that much more.
If reimbursement is partially based on meeting clinical measures, it sounds like a lot like the troubles in education right now. Aren't we going to be seeing people, isn't there incentive there to fix the test so that you perform well?
Well,
move a decimal point.
Yeah, I mean, unlike it, I mean, you know, science, I mean, I guess medicine is a bit science and a bit art. I think the science of it is, you know, if you look at somebody's score for, infections, I mean, it is what it is. Now, you can move a decimal point one way or another, but I mean, either someone has an infection or they don't. And it'll probably be, I think it'll be pretty tough to cheat on that.
Vice President coming to town, possibly the President? Do we know this?
Possibly.
Oh, really?
I heard Vice President's here Friday.
Yeah.
but
No.
There's no contact with the area hospital when something like that happens historically?
We haven't been notified.
We haven't been notified yet. Generally, there is.
Yeah.
They would let us know that, you know, if the President or the Vice President's going to be in town, I would think, just in case there's some emergency, but I haven't heard anything yet.
Vice President right now. Yes.
That'd be great.
Anything else?
Is there anything else on your list that we can get to?
Yeah, anything
We interrupted you.
No, that's okay.
You know, and I mentioned
Go
to Joe,
ahead.
it's kind of interesting. Joe seemed interested when we spoke initially about the topping out ceremony on October 13th. Yeah, we are going to, and this is a new one for me and for us, so this is what we're calling out our topping out ceremony, which is quite a history to it actually, but essentially is when, and this goes way back, you know, centuries, and has some Nordic origins and so forth, where they'd actually, when they were using all wood, take a tree, and Joe knew more about it than I did when I was telling him about it, but they would take like a Christmas tree and raise it as the final piece to the topping out of the facility. So on the 13th of October, on Thursday, on that day, we're going to have, with a steel beam and possibly a tree, but we're going to have a what we call a ceremony and an update on the construction project, which of course it is on schedule. But it's an unusual, but I think a newsworthy event that we're looking forward to on the 13th.
Yeah, often on new construction, we'll see that evergreen tree lashed to the top, and
Yeah,
Yeah.
we haven't had that good fortune. Now we do.
good. I can't think of anything more.
Okay.
Okay.
Thank you very
Thanks,
much.
fellas. We
Thank
appreciate it.
you.